The Ministry of Health and Wellness today launched the National Nutrition Policy at an event in Belize City. The policy is described as a comprehensive approach to nutrition to fight increasing rates of chronic diseases and nutritional imbalances.
And I think that it displays the commitment of the government, and the Ministry of Health, being the leading agency within this, is for us to ensure that we could promote healthy living. As I mentioned in my message, it's not just the matter of living, but it is the way we eat, the things we eat that makes us healthy. There's a task force set up working with Ministry of Agriculture for us to promote healthy living. We need to reduce the non-communicable diseases that are affecting us. Malnutrition and undernutrition leads to these same health issues that you talk about: hypertension, diabetes, cancer.
Their nutrition, their health and wellness.
Francis Fonseca, the Minister of Education, was present at this morning's launch to give his ministry's support for the policy. He shared that the Ministry of Education's goal is to ensure students across the country have access to a nourishing meal daily while at school.
We have launched the National Healthy Start Feeding Program, which is an effort by the government of Belize to provide a healthy meal to all of our students across the country, at least one healthy meal, a nutritious meal. And so that's what this nutrition policy is all about. Of course, this is for the entire country. Belize has been documented in the policy. We are facing a crisis really when it comes to what they call the NCDs, these non-communicable diseases. As you all know very well, we see it every day. People are in desperate need of health care because of chronic diseases.
Dr. Fidel Cuellar of the Ministry of Health and Wellness further explained that the policy will strengthen Belize's nutrition and food security regulatory and operational framework. The policy's main objectives are to increase awareness and promote healthy eating.
They are to reduce malnutrition in all its forms. And not only in all its forms, it's during the entire life course. We're looking to combat malnutrition from the time of conception to the time when you get old and you pass on. Each one of these phases, nutrition is extremely important to guarantee a good life, a healthy life, productivity. We need to teach. We need to learn how to eat healthy. We need access to food. But not only just access, we need food that are free from illnesses.
According to the Food and Agriculture Organization of the United Nations, quote, "Food security exists when all people at all time has physical and economic access to sufficient, safe, and nutritious food," end quote. We asked the Minister of Health about the higher cost of healthy food options when compared to the cost of most unhealthy foods, a reality faced by many Belizeans.
We need to look at the food basket, because when you look, let me point this out. Because why I asked that, I had a discussion with my directors last week, and we were talking about the cost of living, the cost of food, the cost of but what are our people going to eat? What are our people rushing to eat? The ramen and those things that are not healthy. So we need to really take a serious look at what we are making available at cheap prices, which are unhealthy food. Let us make the local grown foods that are better for our people, the healthy foods, more affordable to the Belizean society, and then tax those unhealthy food. That's my perspective. But I think we need to really, like I said, the policy talks about what we should do and what we ought to do as a country and as a people and individually as well in order for us to live healthy.
Reporting for News 5, I am Paul Lopez.